out of the area, as well as promoting soft tissue repair, and by reducing the pain and inflammation. These are all needed to help in the healing process. The laser does not produce any heat, so it can be used over hardware. It doesn't produce any thermal effects. It has no effect as far as damage to nerves or anything. It basically helps you block the pain receptors to the brain so you have reduced pain. So across the country, there's this huge thing on physicians about prescribing pain medication. So pain medication is basically used to mask your problem. What the laser is doing is treating the problem. You're feeling better because you are better. There's more pain medication prescribed in 2010 to medicate every American around the clock for a month. Okay? That's doing nothing to treat your problem. It's just masking the problem. So common things that we treat with the laser would be soft tissue injuries, tendon ligament injuries, ankle sprains, plantar fasciitis, degenerative arthritis. It's used to treat Raynaud's. DPN is diabetic peripheral neuropathy. Postoperative pain, it's used for nerve regeneration. Wound healing, it helps to increase blood flow to the area to help wounds heal. You'll see some slides where it's had unbelievable success in wound healing. It's used for arthritis, for swelling, fibromyalgia, neuromas, Achilles tendonitis. So what is the therapy and how does it work? So the laser is light and light is energy, and basically what we're doing is focusing that low-level light therapy directly onto your problem. By doing that, it's helped to penetrate the damaged cells, help repair at the cellular level. By doing that, we're stimulating cellular activity for the reproduction of new cells. It's reducing pain by blocking, again, the pain receptors to the brain, but also by reducing the swelling. The swelling also can cause a lot of pain, and acute ankle sprains and things like that. By using the laser, we're helping reduce the pain almost immediately after one treatment. This laser is actually, is multi-wave. So there's actually two separate wavelengths that we're using. One is used as a continuous, which is helping reduce swelling and inflammation. The other is a pulsed wave, and that's for pain relief. So with the multi-lock system, what we're doing is getting deeper penetration. So this laser is basically penetrating anywhere from 3 to 5 centimeters into the tissue to help with the healing process. Other lasers have less penetration, so there's more absorption, so they don't get as deep as the multi-wave lock system. So the MLS therapy is the class 4 laser that delivers the most power efficiently at a depth using synchronization and eliminating unwanted thermal effects. Again, there's no heat, so there's no damage produced to the tissue from thermal effects. And again, the two wavelengths work together. The therapeutic wavelength for the swelling reduction helps to vasodilate the capillaries and it basically opens up the lymphatic drainage system. By doing that, we're getting rid of the swelling, helping you recover faster. It's very good in postoperative patients who have swelling. And this laser is actually not just used in the foot and ankle, it can be used throughout the whole body. We can use rotator cuff problems, hand, elbow, anywhere. The pain is the higher one. That's a pulsed wave. There's no negative side effects. It's non-invasive, requires no drugs, no surgery, and basically there's no chance of any thermal effects. The laser light energized jumpstarts the healing process. It helps to get rid of histamines and cytokines. This little bug we need to talk about, but basically it's getting rid of the toxins in the cells, getting them out of there to help you recover faster. It allows for oxygen. So the laser helps your blood cells carry more oxygen. All right? oxygen is what you need to heal. There is something called hyperbaric oxygen treatments, and basically it's used for wound healing, but what that does, it makes your blood cells carry more oxygen to the tissue. This is basically what the laser is doing too. It's helping your blood cells carry more oxygen to the tissue to help it heal faster, as well as getting rid of the toxins in the area. It blocks the pain receptors to the brain. It releases endorphins and cortisol. And basically, if you go out for a run, you feel that high. That's what we're doing. That's one of the things that's being released. It's basically the fight or flight mechanism to give you more relief and make the pain feel better. ATP production is basically, again, that's at the cellular level. That's increased. That's the power given to cells, basically. In bones, for the first 10 days, it helps with bone healing, basically increasing the bone's ability to heal faster. But that only is temporary. It helps to reduce scar tissue. It's post-operative patients. It's reducing the scar tissue over the surgical sites, and again, reducing inflammation, helping the healing process. Bringing blood flow to the area, and also reconnecting nerves and regenerates nerves conductivity. So by helping the nerves function better, basically you're getting increased amplitude into the muscles, which is making the muscles recover faster after surgery or after an injury or trauma. And again, the laser light penetrates 3 to 5 centimeters based on the skin thickness where the problem is. It is basically used by every type of medical specialist, podiatrists, therapists, chiropractors, veterinary, pain management, hospitals all over the country and the world. But it is the only one on the peninsula. So, what are the benefits? Again, it's painless, non-invasive, there's no drugs needed, rapid release of pain, has a strong anti-inflammatory effect. Very quick, with acute sprains, you almost have immediate relief after one treatment. In chronic conditions, it can take 3 or 4 treatments before you actually see the needle moving to the right where we have less pain, especially with arthritis and neuropathy and stuff like that. It doesn't have an immediate effect because it takes more time. Improving the blood circulation to the area and decreasing the time it takes the patient to resume normal activities. There is no known side effects to it, and there's no thermal effects. Again, treatments, conditions that it treat: plantar fasciitis, neuropathy, tendon ligament injuries, sore muscles, strains, degenerative joint disease, peripheral neuropathy, Achilles tendonitis, arthritis, pre- and post-surgical treatments, anti-inflammatory effects, lymphedema, things like that, helping to get rid of the swelling. This is a study that was done, and basically, for typical sprains, it's something called RICE, which is rest, ice, compression, elevation. So this study basically compared RICE, which is, again, RICE, rest, ice, compression, elevation, with the use of the lasers. After 72 hours after laser therapy, 65% of the patients had resolution of their problems with the laser and rest ice as compared to the RICE by itself. Does that make sense? As far as the diabetic peripheral neuropathy, it's helping with neuropathy by basically increasing blood flow to the cells by doing that. Blood flow to the nerves. By doing that, you have increased conductivity, increased sensitivity. With diabetics, they lose sensation. And when they lose sensation, they develop these high pressure areas, calluses, things like that, which then turn into ulcerations, infection, and that's how they start losing toes and feet, legs. It's because of the neuropathy. The neuropathy, I've had patients walk in with nails in their feet. They don't know they're there. Okay, so what this laser is doing is helping increase sensitivity to those nerves so they can feel more sensation on their feet. And it helps to reduce them in burning, tingling, and numbness associated with neuropathy. This is just showing a nerve that was treated with therapy. You can see how on the left how skinny that nerve is, and you can see how healthy it looks on the right-hand side after therapy. This is also showing muscle before and post-therapy. You can see how more beefy it is, and that's because of the increased nerve amplitude to the muscle. It's basically helping that muscle regenerate faster, and this is something that, especially post-surgical, helps with the recovery process. Wound healing. So to heal a wound, you have to have blood flow. If it doesn't bleed, it won't heal. So with this increase in blood flow, that gets, again, to the wounds, help these heal faster. You can see on the left, here's this, a patient was treated for this wound for 15 months with aggressive podiatric wound care. After 5 treatments, in 2 weeks it was healed. Okay? This is a patient with rheumatoid arthritis who's been on steroids, which slows the healing process down. Presented after 4 months of treatment with a wound care center, began MLS therapy. 6 8-minute treatments over 3 weeks, wound was healed. This is a traumatic wound that underwent therapy. You can see that it's healed on the right. So the maintenance treatment protocols are different for every treatment, for every condition. So, sometimes with sprains it may be 1 or 2. Other chronic conditions may be 10. Okay, so the protocols are different for every patient. Typically, the treatment times range from 5 to 10 minutes. Again, it's two wavelengths. One continuous, which is the anti-inflammatory, and one is the pulse, and that's for the pain relief. Any questions?
Sign me up tonight, please.
Excuse me?
Sign me up tonight for the treatment.
Okay.